are going to look at the stages of the syphilis. So to begin with, questions. The first question is, what are the findings in case of the primary syphilis? The second question we want to ask is, what are the findings in case of the tertiary syphilis? So in this video, we'll find the answers to these questions and learn a lot more. So to begin with, we are looking at the primary syphilis. So in case of the primary syphilis, there includes the chancre. So what is the chancre? The chancre is nothing but there is painless. There is painless and indurated. This painless, there's indurated as well as it is single. And the chancre it self heals. The chancre it self heals. It self heals by 1 to 4 months. And there is also presence of the lymph adenopathy. So what does this indicate? There is painless as well as unilateral or the bilateral, and there is the shorty and rubbery inguinal nodes. The shorty as well as rubbery inguinal nodes. So there is also another finding. It is known as the Dory flap sign. And as the chancre is too hard to fold, so the chancre, if you see, it is hard to fold. Since it is too hard to fold, it will flip over once the prepuce is retracted back. So it flips over once the prepuce is retracted back. Next, we move on to the secondary syphilis. So in case of secondary syphilis, it can result in, there can be, this is all about the secondary syphilis. So secondary syphilis, there is a generalized. There's a generalized, it is non-itchy. There is non-itchy generalized rash. Other thing is there is no vesicles. There is no vesicles present. There's no vesicles present on the palm and sole. So if you see, this is the most common lesion. Most common lesion. Next, there can also be presence of the condyloma lata. Next, there can also be presence of the moth-eaten. The moth-eaten non-scarring. The moth-eaten non-scarring alopecia. Next, as we look, they also have the mucus. The mucus patches, they are nothing but it is flat erosions. They are nothing but the flat erosions. So these flat erosions are present on the tongue, and that can coalescence to form the snail track ulcers. It can form the train track. The train track ulcers. And this, if you see, it is the most infectious lesion. Most infectious lesion. So we can highlight this. It is the most infectious lesion. Then there are also the pigmentary. Also the pigmentary plaques. Then there are also presence of the the psoriasiform syphilitic lesions. Psoriatic syphilitic lesions, and then there is also the Generalized diffuse. Generalized diffuse non-tender lymphadenopathy. Next, we move on to the tertiary syphilis. So, under the tertiary syphilis, there is a gummatous syphilis. There is a gummatous syphilis. So, they are nothing but deep punched out ulcers. They are deep and punched out ulcers, and they have a gum-like secretions on the floor. So, they have gum-like secretions on the floor. Next, we also have the pseudo chancre redux. So we have the pseudo chancre redux, and this is a gamma. It is nothing but a gamma, and it occurs at the site of the previously healed ulcer of previous healed ulcer. Next, we look at the CVS. We will look at the CVS. So, in case of the CVS, it can lead to the aortic and the aneurysm of the ascending aorta. Next, when you look at the CNS has general paresis. So CNS has general paresis of the insane and the tabes dorsalis. Then we look at the latent syphilis. So what happens in the latent syphilis? So in terms of the latent syphilis, it is basically a period. It's a period between the secondary. It is between the secondary and the tertiary syphilis. So in this period, the patient is asymptomatic. The patient remains asymptomatic and clinically. So the patient is asymptomatic clinically, and only serological evidence of the infection is present. So there is the serologically it is positive. And what we need to know is that classification. The classification is that there is early latent syphilis. There is early latent syphilis. So the early latent syphilis is nothing but within 1 year, less than 1 year. And after this, there is a late. So late latent syphilis is nothing but greater than 1 year. So now we'll move on to answering our questions. So the first question we asked was, what is the primary syphilis? So what is the primary syphilis? So the answer here is that there is presence of the chancre. There is presence of chancre. So it includes the painless, there is indurated, and it is usually single. Other thing to note is that the chancre itself heals. Itself heals. Itself heals in 1 to 4 months. Next, we need to know that there is lymphadenopathy. In case of lymphadenopathy, it is painless. It is painless, it is unilateral, and it is bilateral. Then there is also a shorty and rubbery inguinal nodes. There is shorty and rubbery. inguinal nodes. Then there is another special feature, that is there is a dory flop sign. So this basically, as the chancre is too hard to fold. So if you see, the chancre is hard to fold. So it will flip over. So what happens is it will flip. It will flip over once the prepuce is retracted back. Flip over when the prepuce is retracted back. Next, we'll move on to the other question. So the other question we asked was, what is the tertiary syphilis? So what is the tertiary syphilis? So in terms of tertiary syphilis, there is a gametosyphilis. So in terms of gametosyphilis, they are nothing but a deep punched out lesions. They are the deep punched out. They are the deep punched out lesions, the punched out ulcers specifically. They are the deep punched out ulcers, and they have a gum-like secretions on the floor. They have gum-like secretions and is present on the floor. Then we also have the pseudo chancre redux. So the pseudo chancre redux is nothing but it is a gamma, and it occurs at the site of previous healed ulcer. Now we are looking at the CNS. In case of, first we look at the CVS. Under CVS, it includes the iotitis and also the aneurysm. Iotitis and aneurysm, and this is nothing but of the ascending aorta. So then we move ahead with the CNS. So under the CNS, it can include the general paresis. So it includes the general paresis of insane and also the tabes dorsalis. And now we will look at the bonus questions. So these questions you can answer them in the comments. So the first question will be, name the findings in case of the secondary syphilis. The next question will be, what are the findings in case of what is meant by the late syphilis? So what is the definition along with the findings? So you can answer these questions in the comments.